Can pelvic inflammatory disease affect future pregnancy? Imagine a silent threat that can quietly change your future plans. Pelvic inflammatory disease is an infection that affects the female reproductive organs, often caused by untreated sexually transmitted infections like chlamydia or gonorrhea. If not caught early, it can lead to serious long-term effects on your ability to conceive and carry a pregnancy safely. When pelvic inflammatory disease is left untreated, it can cause inflammation and permanent damage to the fallopian tubes, uterus, and surrounding tissues. This damage can interfere with how eggs travel from the ovaries to the uterus, making it harder to get pregnant. In fact, studies show that up to 15% of women with pelvic inflammatory disease may experience infertility, especially if the infection happens more than once or is not treated promptly. Another major concern is ectopic pregnancy, which occurs when a fertilized egg implants outside the uterus, most often in a fallopian tube. Scar tissue from pelvic inflammatory disease can cause blockages or abnormal tissue growth that makes this more likely. An ectopic pregnancy can be dangerous and life-threatening because it can cause internal bleeding if the fallopian tube ruptures. Because of these risks, pelvic inflammatory disease is considered a leading cause of ectopic pregnancies worldwide. Beyond infertility and ectopic pregnancy, pelvic inflammatory disease can also cause chronic pelvic pain that lasts long after the infection clears. This pain can affect daily life and sexual health, making intimacy uncomfortable or painful. In rare cases, untreated pelvic inflammatory disease can lead to abscess formation, which is a pocket of pus that can cause further complications. In very severe cases, the infection can spread beyond the reproductive organs, leading to serious health risks. The good news is that early diagnosis and treatment with antibiotics can significantly reduce these risks. If you experience symptoms like pelvic pain, unusual vaginal discharge, fever, or pain during sex, it's important to see a healthcare provider promptly. Regular screening for sexually transmitted infections and practicing safe sex are key steps in preventing pelvic inflammatory disease altogether. In summary, pelvic inflammatory disease can cause lasting damage to reproductive organs, increasing the chances of infertility and ectopic pregnancy. Protecting your reproductive health involves timely treatment, safe sexual practices, and regular medical checkups. Always consult a healthcare professional for personalized advice and care.